Coming in Facebook, coming in YouTube, getting ready to start my show called Jimmy Rants over on Instagram. Got a great show in store for you today with a topic that's in the news right now. There's a lot of talk about this particular topic I'm going to talk about here today, so I'm real excited to share some information with you, something that one of my followers actually sent to me that works in the public school system here in the South. They sent me the guidelines that they are having to follow in this southern school district. So it should be really interesting. Then I have a nice little article that talks about what they're doing with school openings around the world and how they've kept this COVID-19 at bay. So I'm real excited to share about this with you guys here today. What's up, Norma? What's up, Tony? Thank you guys for being here today. We're getting ready to start my show, Jimmy Rants, over on Instagram. And yeah. Got a good thing. Right after this Jimmy Rants is over, I have a podcast over at, or I guess right here, at about 12:30. So I usually record those on video so that you can see the video of it as well as the audio. Hello, Deborah. Thank you for being here today. Hello, Hank. Hello, Nancy. Thank you guys for being here today. And so, yeah, we got a really great topic in store for you today. Guys, this week, the topics that I've had, like waiting in the wings to talk about, I have a stack this thick of so many things that I want to talk about that I just haven't had time to get to, not enough hours in the day. And plus, nobody wants 50 Jimmy Rants in 1 week, so it's okay to spread them out. But I have had plenty of things to talk about. Hello, Johanna. Thank you for being here on the YouTube stream. Appreciate you guys. So we're going to get started over here on Instagram. And today's is a very prescient one because it's all over the news lately, what we're going to do with these public schools when they come back in the fall. Hello, Debbie. I'm going to remind you here on Facebook that you can share it on your personal page or really any page that you are a part of, that you are a member of. You can share this link to this Jimmy Rants in real time as I'm doing it. They can be watching it right there on those pages if you share. So click on that share button and yeah, helps us out. But thank you for being here today, you guys. Gonna get started right now over on Instagram, and here we go. Are the plans to reopen school in the fall going to work during the bleh? That was horrible. Like, this is like the worst time in the world to mess up. Let's try that again. Will the plans in the fall to reopen the schools actually work? Find out here today on Jimmy Rants. Click on that box down there in the corner. It'll take you straight to IGTV for this episode of Jimmy Rants. See, I'm not infallible. I flub up my words just as much as anybody else. Such is life. So Instagram, that's where you can follow me. Go follow me over there at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live in the content and even hear Jimmy Moore flub up his words from time to time. It is known to happen, I promise you. I am not infallible whatsoever, nor do I claim to be. We also simulcast live over here. You guys can laugh at me. That was pretty darn funny. Also simulcast live over here on my Facebook page, as well as on my YouTube stream. So thank you all for being here today on Jimmy Rants. If you missed the live, you can watch it on replay. See, flubs and all, replay over on IGTV. I promise I'm going to start speaking better. IGTV is where you watch the replay. Also over on YouTube, just type in the keyword Jimmy Rants, you'll find the show. Finally, you can see all the past episodes of Jimmy Rants over on the official website, jimmyrants.com. And while you're there, click on the Patreon link, and really any donation of any amount would be greatly appreciated. I do want to let you know we have a bonus episode of Jimmy Rants now available for you to go watch over on the YouTube feed. So youtube.com/livinlowcarbman. I've been doing this lately with the Wednesday episode of the Livin' La Vida Low Carb show, as well as the Thursday episode of Real Talk lately. They're now up as bonus videos for you with Jimmy Rants. So go check out today's. I have a medical doctor, Dr. Cecily Ann. She is a fasting expert doctor who specializes in obesity medicine as well as helping her patients who are trying to get pregnant go on a weight loss plan and a metabolic healing plan so that they can have a baby. So that's a pretty cool interview if you want to watch that, or you can listen to it at llvlc.com a little bit later on. It's usually up by around noon. So there you go. But today I want to talk about a topic that's pretty much all over the news right now, because we have a lot of action happening in regards to what's going to happen in the fall when all the normal activities of life kick back in. I know a lot of parents, they plan their year around the school year. And so when school starts back in August, September, and then it ends in like April, May, that's typically how most parents kind of plan their calendar. And then the summer months are vacation and just a little more freewheeling. But schools are planning on reopening in the fall, a lot of them. And I'm talking about public schools. A lot of colleges, I think I saw all the Ivy League schools decided they were only going to be online. It was funny because Harvard announced, oh yes, we're going to all be online, but it's still going to cost you $45,000 a semester in tuition. I went, well, you would think you could cut those people a break if they're not going to get to be on Harvard University campus, which I've been on that campus. It's pretty awesome. But yeah, so we have a lot of things happening where we're trying to come back to normal. And of course, there's the concerns about the quote second wave of this coronavirus and other concerns. But for public schools, they're setting up protocols. And the funny thing is, every school district is kind of setting up their own protocol. You would think that somebody on a national level would have said, all right, we got all these school districts, you know, and some of them are in districts where the COVID-19 is a lot worse than others, and then some districts have hardly any COVID-19. But all the school districts are having to come up with the protocols on their own, which I think is kind of ludicrous, that you would want some kind of standard, then they all could follow. But no, they all have to come up with their own standard. And I had one teacher who had these protocols sent to him somewhere here in the South. I won't tell you where it is, but this is actual protocols that was just given this week to a teacher in the South by their local school district. They called it Returning, Reimagining, Revamping. And in the 2020-2021 school year, they're going to have pre-kindergarten through the 4th grade. Listen to how their day goes. So they arrive at 7:30 a.m. and they have breakfast till 7:55. The first block is 8 o'clock to 10:25, 145 minutes in a row. Now, I've been in some college classes that are over 2 hours long, and after about an hour and a half, the butt is sore, the brain is shot. I'm not really hearing anything anymore. This is in a college class. Now we're asking pre-kindergartners to 4th grade to stay engaged for 145 minutes. Now it says a 10-minute brain break. If they think one 10-minute brain break in the midst of that first block of 8 o'clock to 10, basically 2.5 hours, they think that's going to keep those kids occupied? Yeah, right. Then after that 145-minute block, lunch. And they get 25 minutes for lunch. It's starting at 10:30. And then they do an activity from 11 to 11:30. Doesn't really say what that is. Second block is from 11:30 to 1:50. Another 2.5 hour block with a 10-minute brain break. Dismissal at 2 o'clock. And that's how their day goes. Okay. Then the 5th grade, same thing, 7:30. But then they have a first block, 70 minutes, second block, 65 minutes, lunch, then an activity, and then third block, fourth block. So basically the same thing, except they break it up a little bit more, and they give them. Now, they get a blended Monday through Friday. Wednesday will be virtual learning. So that's what they say here. So in other words, they go to school Monday, Tuesday, and then Thursday, Friday, but Wednesday, they do it virtually. They don't give any reason why. In the blended, all students and staff will return and follow all this schedule that I just mentioned. Students will have a delayed start after teachers to allow for classroom cleanup and the moving of furniture for as much social distancing as possible. Classes will have no more than 20 students. It's not ideal, but it's a necessary step, says the parenthetical. This may cause some shift in teacher assignments. Divide students into 2 groups per grade, Group A, Group B. For 6th through 12th grade, core classes for secondary will be offered on campus like ELA, math, science, computer science, social studies. Middle school should only consider credit-bearing courses being offered during face-to-face, things like Spanish, MS studies, geography, possibly allow full virtual for seniors who have met all testing requirements. So if you're a senior in high school at this school district, you don't have to go to school. It can be all virtual. Group A will attend Monday and Thursday. Group B will attend Tuesday and Friday. And again, everybody is virtual on Wednesdays. This allows for enhanced cleaning and in-depth planning. It requires parental contact and monitor virtual lessons for students. Now, this is the funny part. How do parents continue to work and yet be a part of those days that their kids are home to be schooling, especially when they're supposed to be looking over and monitoring their learning while they're at home? Do you see how convoluted this is? It's going to be a little bit difficult. And I feel for those parents that have school-age children right now. Like, think about, and you probably want, some of you guys are probably the parents of school-age children. How are you supposed to do your job, which you might be going back to, maybe you're still working virtually. Does your job then also give you allowances for being able to teach your kid at home during the daytime, but then you're able to sneak off and get your work done too? Like, I'm not sure how any of that's supposed to work. Possible partnerships with local colleges to use classroom space and Wi-Fi for seniors in dual enrollment. Daily routine sanitation is mandatory of all the common areas like bathrooms, entrances, exits, common walking areas outside of classroom doors and the office. Hand sanitizers in all the hallways. Teachers will be expected to wipe down their desks during break and transition time, specifically before and after breakfast and lunch. All breakfast and lunch will be delivered to classrooms. A possible sacked breakfast at bus drop-off and car rider line for the quick pickup. If you're just joining us, I am actually reading from the official return to school reopening plan in a school district somewhere here in the South. I'm not going to tell you where it was, but it was one of my followers who sent this to me and said, hey, take a look at what they're trying to have us do when the kids come back to school. These are all the protocols in place, and it's pretty interesting. All the things that they're asking these teachers and students to be doing. Use the classroom sink for regular hand washing. K1 sanitation of shared electronics. Sanitation of all electronic devices at the end of the day. All classrooms need electric pencil sharpeners. Teachers will supply sharpened pencils every day. Group students and allow them to stay together in pods throughout the day. So I guess if your little buddies in this pod, you're with those buddies all day. What happens if there's a behavior issue? How does a teacher handle a behavior issue in the midst of COVID-19? I didn't see anything about that in here. What about bathroom breaks too? Like, kids, they gotta go pee. Teacher, I gotta go pee. They have to, I mean, there's a lot of unanswered questions in all this. Assigned seating will be strictly enforced for all students. Again, the pre-K through 4th grade. Yeah, good luck telling kids to stay strictly in assigned seating. Credit-bearing electives will be integrated through virtual instruction. Special elective teachers rotate and leave students in classrooms as much as possible. Multiple locations for arrival and dismissal to allow for social distancing and temperature checks. They're going to be testing their temps every day. Students will report directly to their classroom. The amazing part to me is, especially in the higher grades, they're going to have them come to school, and they're used to, in like middle and high school, they're used to changing classes. Not now. They're going to keep them in the same classroom the whole friggin' day. And I don't know about you, but part of the experience, and I get it, we're in the midst of a global pandemic with health stuff, but part of the allure of middle school and high school was being able to change classes, see different people all day long. That's a part of the experience. Now you're going to be in the same class with these same people all friggin' day long for the school year. It's going to be interesting to see how they handle that. All right. Some things to consider. Allow for virtual school for students with health conditions. So they're going to allow for virtual school for kids that want to opt out because of, quote, health conditions. Why not make it virtual for everybody? Like, why go through all this rigmarole to bring them on campus if there's that much risk and concern about what's going to happen? Like, why is that a bad idea? And plus, they're home for 3 of the days a week anyway. They're only at the campus twice a week. Group A comes those 2 days, Group B comes the other 2 days, and everybody's off on Wednesday. Why even have this charade of coming on campus? What do you get on campus that you don't get at home? And I'm wondering also some of the psychological effect of kind of all this, everything I'm about to share, that they're going to have to do in the midst of this. Are kids actually going to get to learn, or will they not be able to concentrate because of all these distractions? Like, kids already have a hard enough time staying focused and doing what they need to do under normal circumstances. Can you imagine all these rules and regulations that none of them understand? Like, let's be honest. A lot of us adults don't know what's going on with a lot of this stuff. And yet now we're going to expect these kids to embrace it all and be happy about it? Yeah, I don't think so. Multiple drop-off points for arrival, scan temperatures and have specific people to do that. How will they be recorded to ensure every student was scanned? So these are things to consider when they come back. Unloading every other bus if there's only one drop-off location for buses. So that's the other thing. On the buses, they're going to have kid, empty seat, kid, empty seat, kid. So they're going to have to do a lot more routes than they normally do, because normally they pack those school buses. So they're not going to be able to get all the kids. Although, you know, with the rotating of the kids, like, how do they know that they're getting kids at this bus stop to make sure that one's in Group A, the other's in Group B? Like, it sounds to me like a logistical nightmare. How are they going to keep up with that? Dismissal procedures to allow for as much social distancing as possible. Call by bus in multiple locations for car riders. Yeah, across the street over here is one of the biggest public schools in South Carolina, and there is a long line of cars that line up right around 2:15 in the afternoon to pick up their kid. And yeah, I don't know how they're gonna like stagger those, because it like blocks the traffic. I know at 2:30 in the afternoon I'm not getting out of my neighborhood till at least 3:15. That's about the time it all clears up and it's all ready to go. How are they gonna do that in the midst of COVID-19, trying to allow for multiple car locations? Like, it's already backed up at that one place. Where else are they gonna go? I don't know. A clear system for food distribution, possible school level teams that serve the same grades each day. Have a list of students to check off, and cafeteria staff will enter into computer system for a record of the number of people they fed each day. If students must change classes, setting up groups of students to only move one door to the right in a circular motion if the school facility allows for that type of transaction. So in other words, if they need to move a room, they're only allowed to move one room over. That's it. And it's going to be a one-way move. So if we're in this classroom and they need to move one room over, and that's your classroom. Is that practical? I don't know. All hands on deck in hallways when transitions occur, I guess to ensure discipline of social distancing and all that. Unplug the water fountains. This will not render them inoperable. We'll need to cover them to restrict the use. Yeah, they'll have to probably put a big garbage bag around it. Maybe put like a poison sign over the water. Now, if you're gonna get rid of the water fountains, are you going to give those kids water? I can tell you in the midst of the school day, I'm thinking back many years ago, I used the water fountain a lot because I was dehydrated quite a bit. And can you imagine kids getting dehydrated if they don't provide water somehow in the classrooms and they start getting a headache and they can't focus and all the things that happen when you get dehydrated? Do they have a contingency plan for that? Nothing is said in this protocol. Rethink your restroom procedures, paper towels, tissue, and soap in every restroom, checked frequently by the custodial staff, taping off every other stall and sink, and limiting the number of students who leave the classroom for restroom breaks. Oh, when I was a kid, they wouldn't let more than one at a time go to the bathroom. You basically get a hall pass that was a restroom pass, and you carry that around. Sometimes it was a little wooden little thing, and yeah, they wouldn't allow more than one at a time. Keep all book bags at home. Have caddies under each desk and somewhere in the classroom for students' books and supplies. Consider having the classroom ventilated, fans on in the classroom, crack the windows if the weather allows. UV light is beneficial, open blinds as much as possible. So they're thinking the UV light coming through, that if there's any risk of the coronavirus, maybe that helps to kill it. I don't know. Keep all outside doors locked. Post a number for any visitor to call before they're allowed to enter the building. Who meets them at the door to scan the temp. Revamp check-in and check-out. There is no way in you know where that I would allow anybody to come on the campus if you have a very safe environment, a bubble, so to speak, for these schools, and then somebody randomly comes in from the outside. Yeah, they're going to have to go through all the same protocols that the kids and staff do. How can we utilize every staff member efficiently and effectively? Remember, I'm reading from directions given to teachers in this school district in the South. Teacher assistants, interventionists, elective teachers, possibly have these teachers report to classrooms instead of moving students. PE using Move to Learn or other kind of exercises while in place in a classroom. Office staff, counselors, behavior counselors. Sibling sets at schools when grouping students. Sibling sets. So that means if you have a little brother or sister, you may be going to the same classroom with them. Like, how are they going to do that? That don't make any sense. Social, emotional support for students and families. Oh, I'm having a mental breakdown reading all this. This just, like, are we thinking this through a little bit? Is all of this rigmarole I'm reading worth all the emotional toll? When they shut everything down in March, everybody came home and they started setting up virtual classrooms. Now that was done on the fly. Now that they're starting anew in the fall, what is the downside of continuing that plan other than what I mentioned earlier? Are parents supposed to just stop everything in their job to work on their teaching their kids? This is going to be interesting to watch, you guys. All right, so to cut down on contamination to and from home and school, the school should supply each classroom and student with the following items: hand sanitizer, Lysol wipes, Lysol spray, hand soap, sticky chart paper, easel, dry erase markers, electronic pencil sharpener, pencils, wide ruler paper, calculators, colored pencils, highlighters, cardstock, graphing paper, handwriting paper, glue sticks, scissors, crayons, construction paper, binders, storage bins. So all of that's going to be provided at the school. And here's the thing too, it's not in this list, but the same person who sent me all of this also said they're going to give them 2 sets of books. One set of books to use while they're at school, and another of the exact same set of books that they will keep at home with them. That way there's no contamination of surface from the book into the classroom. This is real, guys. This is exactly what one school district somewhere here in the South, I won't tell you where, but it's definitely one school district. And this is just one school district in all the school districts in America. And ostensibly every school district is having to do this exact same thing with their own protocols. Like, this is a nightmare waiting to happen, because this one is pretty stringent here. And what's to stop another one from being lackadaisical? What's another one from being even more stringent? It's going to be interesting to watch the ones that choose to do all virtual. from the start. And again, I have to ask, how is that going to work with parents? Are they going to allow the kids to be self-sufficient at home and check in virtually? How do you cut class when you're doing virtual learning? Like, can that happen? Just a lot of questions. I did find this article from sciencemag.org. School openings across the globe suggest ways to keep coronavirus at bay despite the outbreaks. So I'm not going to read this whole thing, but I wanted to touch on some key things. 1.5 billion young people have been staying home from school because of the coronavirus. And they have tried their best to do this virtual learning, like I said, here in the spring into the summer of this year. Continuing closures risk scarring the life chances of a generation of young people, according to an open letter that was published this month, signed by more than 1,500 members of the United Kingdom's Royal College of Pediatrics and Child Health. Virtual education is often a pale shadow of the real thing and has left many parents juggling jobs and childcare. That's my concern. Low-income children who depend on school meals were going hungry. Now, I heard about here locally in my area, I don't know how it is in your area, but here locally, the kids, the cafeteria staff at the kids' local school are making the meals and they're hand delivering them to the neighborhood for the kids to come pick up. So that's still happening, at least here in South Carolina. I'm sure it's happening in other places. So if that's the concern, that should be acquiesced if you're able to do that same kind of thing that we're doing here. But that is a concern. There were hints that children were suffering an increase in child abuse, which is another concern of being home during the lockdown. Now that the school staff could no longer spot and report it early on, it was time, a growing chorus said, to bring children back to school. So they're making the argument, this Royal College of Pediatrics and Child Health, that they need to go back to school physically again. More than 20 countries by early June had done just that. Some include Taiwan, Nicaragua, and Sweden. They never actually closed their schools. It was an uncontrolled experiment. Some schools imposed strict limits on contact between the children. Others let them play freely. Some required masks. Others made them optional. Some closed temporarily if just one student was diagnosed with COVID-19. Others stayed open even when they had multiple affected in staff and children, sending only ill people and direct contacts into quarantine. Data about the outcomes of what that did are scarce now. A pediatrics infectious disease specialist at Vanderbilt in Nashville said, "I just find it so frustrating." She works and advises in the Nashville school system, which serves more than 86,000 students, on how they should reopen. Her research assistant spent 30 hours looking for data, for example, on whether younger students are less adept at spreading the virus than older ones, or whether outbreaks following reopenings, and she found little that addressed this risk. When the Science magazine looked at reopening strategies from South Africa to Finland to Israel, some encouraging patterns started to emerge. Together, they suggested a combination of keeping student groups small, that was one key, and requiring them all to wear a mask. And some social distancing will keep schools and communities safe, and that younger children rarely spread the virus to one another, nor do they bring it home. But opening safely, experts agree, isn't just about the adjustments that a school makes. It's also about how much virus is circulating in that particular community, which affects the likelihood that there will be an outbreak in the classroom. Outbreaks will be inevitable, according to an infectious disease pediatrician at the Finnish Institute for Health and Welfare, his name Otto Helv. But there is good news. So far, with some changes to schools' daily routines, the benefits of adding school seem to outweigh these risks, at least where community infection rates are low and officials are standing by to identify and isolate those who come in contact with someone with COVID-19. All right, so they cite a few studies about how likely children are to catch the virus, and the conclusion is very low that they would catch the virus. High school students have to be very careful though. They have mild disease, but they are contagious. Children younger than 11 or 12, on the other hand, probably don't transmit very well. I would love to know why. Why is it because the immune system is stronger in the younger, and maybe some of these teenagers that are in high school, their metabolic health starts to go down? I'm trying to figure out what would be the mechanism as to why children 11 or 12 are not as contagious, whereas these older teens would be. They are close to each other in schools, but that is not enough to fuel the spread, talking about the 11 or 12-year-olds. At the same time, scientists note that children have more contacts than adults, especially at school, which could offset the lower odds that they spread. Other outbreaks also suggest that elementary school pupils pose a smaller threat than the older ones. Among the worst school-wide outbreaks was at Gymnasium Rehavia, a middle and high school in Jerusalem in Israel. 153 students and 25 staff were infected in late May, early June. An outbreak at a New Zealand high school before that country shut down infected 96 people, including students, teachers, staff, and parents. In contrast, a neighboring elementary school saw very few cases at all. The picture is still blurry here. Another Israeli outbreak was in an elementary school in Jaffa with 33 students and 5 staff members affected. Around the globe, an elementary school in Trois-Rivières, Canada, had 9 of 11 students infected after 1 got the virus. Other data come in from the daycare centers. In many countries, they stayed open for children of essential workers. Outbreaks appeared very rare. 2 flare-ups happened in Canada daycares, 1 in Toronto, 1 in Montreal, led to a temporary closure. In Texas, overall cases have skyrocketed. At least 894 preschool staff, 441 children across 883 facilities have tested positive. That's up from 210 total cases just a few weeks ago. Tracing transmission through the schools, 1 student at a time, should help elucidate whether the virus tracks differently in children of different ages. Again, I would love to know why the younger ones are less contagious and why the older ones are more. Another clue about age-based spread came in from another timeline of new infections among high school students at this place and staff. New infections dropped off sharply once winter break started. But in the elementary school, the already low rate of new cases held steady. That pattern suggests that while high schoolers were catching the virus at school, the young people caught it from family members and not from their classmates. So, again, if you just joined us, we are hot and heavy in talking about this whole idea of reopening schools this fall in the midst of COVID-19. And I'm asking the question if it's safe, practical, and effective. And I read at the very beginning, if you missed the beginning, I read from some specific protocols that one school district here in the South is implementing. And now I'm reading from a story in Science magazine all about how this has worked around the world with mixed results so far. And so the next question is, should children be able to play together? The scenes hardly resemble typical school. Preschool children instructed to spend recess playing alongside a chalk square. I've actually seen pictures online where they have hula hoops and they tell the kids, don't leave that hula hoop. And then they socially distance the hula hoops. So basically these kids are imprisoned while they're at school. 8-year-olds told not to talk to their friends because we don't want any spittle coming out of your mouth that could then go in their eyeballs and give them COVID-19. That's what they're thinking. Middle schoolers reminded to steer clear of classmates when entering or leaving the building. Man, middle school is so awkward already. Like, I remember middle school, it sucked. I hated it. I was the weirdo. And it's already hard enough. Can you imagine taking a socially awkward middle schooler and then having them do things that are outside the norm? And what about all those kids? And I'm just thinking out loud here. What about all of the kids, all of the people that have that personality type that when things get changed up, they don't do well? I don't know. I mean, we know kids can have outbursts when things are kind of out of kilter. There's certain personality types where if you change anything about the normal routine, their brain doesn't handle it well. How do you handle that situation with all of these changes? Again, it's going to be interesting to watch. As schools reopened, many embraced physical distancing for students to prevent the spread, but although the strategy is effective, it is leaving more and more scientists, pediatricians, and parents deeply uncomfortable. They hunger for a compromise that protects communities from COVID-19 while also supporting the mental health of these kids. There has to be a level of risk that we're willing to take if a child is going to go to school, according to an epidemiologist in Montreal named Kate Zinzer. Schools are where our children run around, play, and laugh and argue. They need to return to have that sort of healthy normality as soon as possible, according to Russell Viner, the president of that RCPCH, the group that I was talking about at the beginning. From the start, some countries bet on strands of research suggesting young children are unlikely to spread the virus. Schools in the Netherlands cut class sizes in half, but they did not enforce any kind of distancing amongst the kids under the age of 12 when they reopened. Other schools had a pod model as a compromise. Denmark was the first country in Europe to reopen schools, assign children to small groups that could congregate while they were at recess. It also found creative ways to give those groups as much space and fresh air as possible, even teaching the classes in a graveyard. What? Some classes in Belgium met in churches to keep the students spread out. Wait. Let me back up to the graveyard one. They went to a graveyard? Was that the only place they could go? Where was that? That's the only place they could go in Denmark? Was a graveyard? Yeah, I'm over here next to the dearly departed Mr. Smith, and I'm looking at this tombstone. I can't pay attention to the teacher because I'm sitting next to a dead guy. Like, that's creepy. Ugh. Finland has kept their class sizes normal, but prevents classes from mixing up with one another. As spring wore on, many other countries began rethinking the distancing. The Canadian province of Quebec, which reopened many elementary schools in the month of May with strict distancing, has announced fall plans that allow children to socialize freely only in groups of 6. Each group must stay 1 meter away from other groups of students and 2 meters away from teachers. So what's a meter? Like, I'm horrible. I'm an American. I don't know what a meter is. I think it's about 3 feet, 4 feet, something like that. Although French preschoolers were photographed sitting inside their own recess squares in May, daycares there have now abandoned all the distancing rules for children 5 and under. Older students are advised to stay at least 1 meter away from others while inside. Outside, they can play freely with others in their class. The Netherlands recently announced that anyone under the age of 17 no longer needs to distance from one another. The change is driven not just by pediatricians' advice, but also by practicality. A full school building leaves little room to distance. See, that's going to be another challenge when all these schools start back up. How are they going to control, like, traffic flow? All right, we have this set of students outside, so we can free up space to move these students around to these classes, and then we keep these students here, and then they move over here, and they go. Can you imagine the person that has to come up with the Venn diagram to keep up with all the traffic flow? Again, it's going to be interesting to watch. 2 weeks later, classrooms welcomed back all their students, housing their usual 30 to 40 pupils. Distancing in class was impossible, so the country embraced, at that point, wearing masks. So that's going to be a controversial one. Should kids, when they go back to school in the fall, be required to wear a mask? They address it in this article. Masks likely will blunt the spread of COVID-19 at school, but children, even more than us whiny adults all complaining about masks, find them uncomfortable to wear for hours on end and may lack the self-discipline to wear them without touching their face or freeing up their nose. Does discomfort override a potential health benefit for the public? Here's the thing. What about those kids that have asthma? What about those kids who don't breathe well? We're not going to require them, obviously, to wear a mask. So then what happens when a kid who has to wear a mask that does not have that asthma or other condition which would make it hard for them to breathe, what would stop them from saying, no fair, they don't have to wear a mask, I'm not wearing a mask, and there's a revolt on hand? Like, I'm trying to get down to like practicality of some of the things that they're asking about here. We know kids are gonna be all kids, and they're going to complain if somebody gets an exception. So then what do? You make the asthmatic kid wear a mask to appease the others that they're not? I guess they could give them those little face guard shield things so they can still breathe, but they're still protected. I guess that would be the solution, but yeah, they're just asking for discipline problems. Susan Coffin is an infectious disease physician at the Children's Hospital in Philadelphia. She says, for me, masks are a part of the equation for slowing the spread of COVID-19 in schools. Respiratory droplets are a major mode of virus transmission, and wearing a mask places an obstacle in those droplets' path. In China, South Korea, Japan, and Vietnam, masks are already widely accepted and worn by many during the flu season. Yeah, this is something Americans don't realize. The mask wearing thing is so new to us because we hardly ever have worn masks, at least on the grand scale that we do now. In China, South Korea, Japan, and Vietnam, it's regular. Every flu season, they just wear a mask. They don't even think twice about it. It's such a normal part of their culture. And I wonder if that's why America has had a little more trouble with COVID-19 than some of these other countries. We're having such a radical shift and change in the way we handle this coronavirus as compared to the common flu, which is another coronavirus, whereas all these other countries that I just mentioned, they're used to wearing a mask, so it's been no big deal for them. The schools require them for almost all the students and teachers there. China allows students to remove their masks during lunch when children are separated by glass or plastic partitions. So kid, partition, kid, partition, kid, partition. Can you imagine the kid, and then have a partition in front of you so the kid in front of you doesn't spit when they're talking? Anyway, what? What'd you say? What? Just practically, I'm thinking all these things through, and part of the school experience. It's gonna be interesting. Israel is requiring masks for children older than age 7 outside the classroom, children in the 4th grade and above all day, and they all comply. On the bus ride to school, all the kids are sitting with masks on. They don't take them off, and they listen to their orders. Well, they're a lot better behaved in Israel than they are here in America. Elsewhere, masks are less central. In some schools in Germany, students wear them in the hallways or bathrooms. They can remove them when they're seated at their distantly spaced desks. Austria reopened with this approach, but they got rid of the masks for students a few weeks later when they saw there was very little spread happening in the schools. In Canada, Denmark, Norway, the United Kingdom, and Sweden, mask wearing was only optional for all students and staff. Not all countries have the luxury of having a mask policy driven by science and comfort. Benin requires masks in public spaces, but because the cost can be prohibitive for some families, schools do not turn maskless students away. Students in Ghana returned to school in May wearing masks if they had them. South Africa, which faces a rising load of COVID-19 cases, is racing to provide masks to their students who need them. That's going to be another thing. What about those school districts where you have parents that can't afford masks? Will they have masks available for these kids for free? And if they do, where does that money come from? How do they pay for those? A lot of interesting questions. All right, let's skip forward just a little bit because it's a long article. So what should schools do if somebody tests positive? Nobody knows, is what they said in this article. That's largely because of the lack of data about how many silent cases might be brewing when an illness or two comes to light. How do we best deal with an infection? Do we just close down the classroom, or do we close down the school? Some schools have favored isolating only close contacts. In Germany, classmates and teachers of an infected student are sent home for 2 weeks. But other classes will continue until summer break. Quebec generally did the same thing. At least 53 students and teachers tested positive after many of them reopened. But officials believe many of those were contracted in the community and not at the school. Elsewhere, officials are more cautious. Taiwan, which has largely suppressed the virus there, kept schools open after 1 case, but said it would close them if they got 2 or more. but it's not yet faced that situation. In Israel, schools closed for one singular case. Close contacts of every infected individual were tested and quarantined. By mid-June, 503 students, 167 staff were infected. 355 schools were closed, and that's out of the total of 5,000 schools in Israel. Widespread testing in schools, including of children without symptoms, could help officials choose the most effective policy. In the UK, they recently began a study of as many schools as they could get. The project will test students and staff at preschool, primary school, secondary school several times over the 6-month period for both the virus and the antibodies in an effort to map the transmission patterns and viral prevalence. In Berlin, Germany, researchers launched a study in 24 schools starting in mid-June, 2 weeks before summer break, that will test a cohort of 20 to 40 pupils, blah, 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 blah. So they're just trying to see the pattern of the spread. So the question is also, are schools the ones spreading the virus to the community? And that's the concern that people have. All right, all these schools are going to have all these kids back. Are they going to bring that virus back home with them and into the community? They answer that question here. Children so rarely develop any kind of severe symptoms with COVID-19. Experts have cautioned that open schools might pose a risk to teachers, family members, and the wider community. Many teachers and other school staff are understandably nervous about returning to the classroom. In surveys of U.S. school districts, as many as 1/3 of the staff want to stay away in the fall. Don't blame them. We could find very few reports of deaths or serious illness from COVID-19, but information is sparse. Several teachers have died of COVID-19 complications in Sweden. Schools did not modify anything. Early data from European countries suggests the risk to the wider community is very small. At least when local infection rates are low, opening schools with some precautions does not seem to cause a jump in infections. Let's see, I'm running out of time, so I want to make sure I skip ahead if there's anything else in here. All right, so what lies ahead? In much of the world, schools that closed in March remained closed throughout the summer break, and the autumn will see a wave of reopenings for millions of especially vulnerable children. However, the break may continue indefinitely. Many low-income countries lack the resources to shrink their class sizes, nor can they provide everyone with a mask, and so they're hesitant to reopen in the midst of the COVID-19 pandemic. In June, Bangladesh Prime Minister Sheikh Hasina said schools will likely stay shut until the danger has passed. Well, when's that going to be? Like, COVID-19 is here to stay for a little while. It is. So are they going to just keep it closed indefinitely? What happens to the education of the kids there? Similarly, officials in the Philippines said in-person schooling will not resume until there's a vaccine to protect us against COVID-19. And again, I say, when's that going to be? And does the vaccine just automatically cure this COVID-19 just bing, overnight? No. Won't be effective for everybody. In other places ranging from Mexico to Afghanistan to the United States, planning for the fall of 2020 is currently underway. In the U.S., school districts are releasing a patchwork of plans, which I described one at the very beginning of this, an actual plan happening here in the South, which often includes a hybrid model that alternate distancing with small in-person classrooms. Whether those plans sufficiently will protect children, staff, and communities will depend on how case numbers look as opening day approaches. This reality was thrown into stark relief late last month when Arizona's governor announced he was going to delay the schools reopening by 2 weeks because of a surge that was happening there in cases. The experiment is going to continue. Scientists lament that, as before, it may not generate the details they want about infectious patterns and paths of transmission. There just isn't any really culture of research about this. Gathering data from school children comes with layers of complexity beyond a traditional pediatric research. In addition to seeking consent from parents and children, it often requires them to have buy-in from teachers and school administrators who are already overwhelmed by this new reality. Integrating research, the only way to gauge the success of these strategies, may be more than they can handle. I thought that was a really good article. It talks about what they're doing around the world with these school reopenings. And like I said, that one school district here in the South somewhere has interesting protocols. Like, what do you think about this? Is this going to work? Do you agree that we need to have the kids physically back in school? Would making it all virtual protect everyone from being exposed to COVID-19? But then what's the psychological effects of that? If we're not going to have kids interacting with kids, I do know some kids in my life, especially teenage kids, the lockdown was mentally very hard on them. And they did not do well. And when they started reopening things and they could get back together in social settings with their friends, things got better. But what's going to happen if you indefinitely have this separation from the friends, and how do they actually learn, and can they concentrate if they don't have those social connections, which are just as much a part of the school experience as the learning, those social connections? So what's going to happen there? This is a messed up time in our world. Have you noticed? I want to see what you guys have to say here. I'm going to come to Instagram first, then over to Facebook, finally over to YouTube. Thank you all for being here today on Jimmy Rants. JimmyRants.com is the website. See what you guys have to say about this one. Oh, I knew Bridget would chime in. She's got a bunch of kids. My kids' school says masks will be optional. They are going back. They will probably bring home the typical viruses that they always do. Yeah, and that's the other thing. It's like COVID-19 is not the only thing that could be spread. Like the seasonal flu still is out there. So it'll be interesting to see how that works as well. Low Carb New Yorker says New York City is taking about 2 and 3 day rotations for cohorts. I wonder how they're planning on doing that without entirely crushing the economy more than it already has been. Yeah, that's a whole nother topic altogether on this one, man. The images I've seen of Asian schools show less limiting proximity, more installation of personal barriers between the seated students. Yeah, the whole plexiglass set up between, I've seen a lot of those kind of pictures. I wonder if the price for the barriers would be less than the logistical nightmare of all the extra busing and financial impact on cities as a whole, as parents are unable to go back to work full time. That's the other thing. I don't know how parents that have a full-time job, and are these companies going to work with them because they have kids that are school age, that they have to be there to help monitor their education, but then they have to do their job? How many people are going to lose their job because they were trying to be a good parent to their kid that happens to have to get educated from home? There are so many moving parts to this discussion. Kat says distancing in elementary schools, masks, good luck with that. I'm laughing already. Kat knows because she has young children. The irony is 100 years ago, the United States was the trendsetter during the Spanish flu outbreak for wearing masks, but now all that entitlement that people are feeling everywhere thinks they don't. Yeah, I remember seeing a vintage picture from the 1918 flu epidemic, pandemic, where they were at a football game and everybody was wearing masks, so it wasn't a big deal. Kat says, have they figured out all the ways of transmission, by the way? Droplets, is it airborne? Yeah, I read a story last night. COVID-19 is actually airborne and scientists haven't figured that out yet. I'm like, well, how do we know it's airborne yet? Like, let's wait for the science to actually show that. Carla says, mask your face, not your heart. Kat says, masks to be provided. It's clear, surgical masks, dirt cheap, not bringing your own cloth mask being God knows where before you. Laura says, just more medical and socio-psychological problems will occur. Oh my gosh, like I am so concerned. She said high-risk kids will fall through the cracks. I know, and I'm sincerely worried about that. Like I said, there's a lot of kids that are on the brink. And think about those kids that are in abusive homes, emotionally and physically and sexually in all the ways. And some of those kids are already on the edge emotionally. And then to be brought into this situation, I fear for them, guys. Like I honestly, in my heart of hearts, don't know how it's going to happen. Lauren says, yes, I worry about the parents and their kids. My nephews are not in a good home as it is, and I'm worried about them and not going to school. Yeah, school is like the one time a day, and this is something people don't like to talk about, but it's a reality. School is the one time a day a lot of kids get away from the abuser. As someone who was abused as a teenager, I loved going to school because it meant I wasn't going to get my head smashed into a wall for about 6 hours. And that's real. And we need to be accepting that reality and thinking this through a little bit. And is that worth the risk of COVID-19 to get those kids to get to go to school and have the connections that they need so that maybe they don't hang themselves in their bedroom? I don't mean to be grim, but I would not be surprised if we see a lot of that happen in the fall when all this starts happening again. All right, thank you, Instagram. Let me pop over here to my Facebook page. What's up, guys? Thanks for being here today. See what you have to say. Judy says special needs kids depend on a strict schedule. Yes, those are the ones I'm thinking about. Those special needs kids are going to be the most vulnerable during all this. Sounds like a disaster for them. I agree. Courtney says, what a nightmare. Just imagine the long-term effects of this trauma. That's the other thing. It is trauma. The isolation, all the effect on mental health. I've been sounding the alarm about that since all this went down with the lockdown. And we've seen some very heartbreaking stories about how it's already caused some kids to take their own life. And I would not be surprised if we see a big spike in the fall. I don't want to say it that way, but I think it's inevitable. Laurie says, I'm a teacher, and although I am ready for a normal year, this year is kind of scary to me. I'm a veteran teacher of 23 years, and yeah, you're conflicted right now. You don't know what to do. Like, there's so much like back and forth about, is it spread easy? Is it not? Are the kids safe? Are you safe? Like, I don't blame you. If I was you, Laurie, I would think you would want to push for all virtual, because it would be easy for you to go in your, I mean, we have technology. You guys are watching me on a major form of technology. I have 3 different devices on all at the same time for you to watch Jimmy Rants. How easy would it be to do a Zoom call with your students from your house and teach them that way? Now, of course, you have to rely on parents on the other end to discipline those kids, but you can do it. And if that's going to make you feel most safe, then that's an option we need to be having on the table, not demanding that we do this whole gobbledygook of 2 days here, group A, 2 days here, group B, everybody virtual on Wednesday, and it's a mess. Why put them through all that? Nancy Booth says, our school board in Virginia Beach struggling with this right now. There are many levels of mental, physical, and academic issues that come into play. We should know the plan within a couple of weeks. I think it will come down to an acceptance of a certain level of risk for kids going back to school with the option of all virtual classes for those opting out of physical distancing. There is no perfect answer. There isn't. There isn't. And I hope they do let people opt out on a whim for whatever their reason or no reason. Jenny says, what are the dangers of a generation developing for a long while in isolation? Aren't there critical milestones in kids' social development that when not played out well, later manifest as pretty messed up adults? Oh my gosh. Jenny, you have identified something that, again, I am extremely concerned about. And what about those high school students? Which this is like supposedly the best time of your life. You're finishing up your school, especially juniors and seniors. Finishing up the school, and you're about ready to kind of embark on all the everything of getting accepted to colleges or going into the workforce, or and then having those relationships with people. All of those are a critical part of your life development, and it's going to be gone. Like, I think about all those kids in the spring. They didn't have a prom. They lost their senior prom. They didn't get to graduate and walk. A lot of them did have graduation ceremonies, but some didn't. Some only got it virtually. And that's a lifetime milestone that you count on. Yeah, I agree with you, Jenny. I think the lasting effects of this, it's going to be interesting if epidemiologists continue to follow some of those kids as they go into adulthood. What impact did this have on them? Of course, quantifying what COVID-19 did and the mental health effects and blah, blah will be a little bit difficult, but you can look at what normal circumstance data would be and compare it to that. It will be interesting to see if there's any increases in various things and disturbance behavior. All right, thank you, Facebook. Let's pop over here to YouTube. I'm down 100 pounds since starting keto IF in January 2020. Whoa, 100 pounds in like almost 6.5 months. That's great. Only 80 more pounds to go. Way to go, Greg. That is cool. Shirley says, I'm going to be homeschooling this year. My son will not do well with a mask that he's required to wear the entire time. It's a shame because I would like to be working. You're articulating my concern. How many parents can just give up their job? They gave us the option to do digital learning class if we wanted to pick that option, but that would require my kid to have their own device, and I only have one. Hey, if it means you don't get to watch Jimmy Rants anymore and you let your kid have your device, I'm just kidding. I hope it works out for you because, yeah, that's not an ideal situation by any means. All right, thank you, YouTube. Let's come back over here, see if there's any final thoughts. Laura just says hello, hello. All right, so yeah, the school in the fall is going to be quite interesting to watch, you guys, because these reopening plans are happening. And I read you one here in the South, one school district here in the South, and it's very, 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 very interesting how they think they're going to enforce kids wearing masks and social distancing and don't play with it and have it on all day. Oh my gosh. God help us all. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. And as always, you can engage live in the content, but you got to go follow me right here on Instagram. I am at Living Low Carb Man, LIVINLOWCARBMAN. Once you're there, engage live. We also engage live, simulcast, over here on my Facebook page. So thank you guys for watching here today. And finally, over on my YouTube stream, thank you guys for all your input and everybody here today on Jimmy Rants. If you missed the live, you can watch it on replay right here on Instagram, IGTV. We also put all the past episodes up over on YouTube. Just type in a keyword, Jimmy Rants. You will find the show. Finally, pop on over to JimmyRants.com, the official website for this show. And yeah, you can see all the past episodes while you're there. And if you like what we do here, click on that Patreon link, and really any donation of any amount would be greatly appreciated. Caviar says, eat raw meat, raw fat. Well, that's a great way to end the show. Do that. And until next time, we'll see you then. I love how people come on there and they like have their own agenda. Eat raw meat, raw fat. I'm like, what are you, a drive-by commenter? Okay, whatever you say. Well, let me get off of here. I do have an interview at 12:30, so I need to get off of here and get ready for that one. But thank you guys for being here. I hope this was informational. And if you have kids of school age that you have to send back to school in the fall or have the decision about what you do, I feel for you. I really do. Not going to be an easy decision no matter what you choose. All right, guys, let me pop off of here for now. We'll see you again soon. Bye. Bye, YouTube.